Hello class, today in my issue speech I will be talking about a very hot subject on the market. I am talking about legalizing medical marijuana. Now I know that the debate for legalizing marijuana has been up in the air for years. We have people that are pro marijuana just for medical uses, and then we have people that are not so fond of the idea of using medical marijuana. Um, I know this has been a hot topic, and doctors have done lots of tests. We have some doctors that have proven facts that the medical marijuana can indeed help patients that are struggling with pain, chronic pain, um, patients with Parkinson's disease, anything that has pain to do with it. Medical marijuana is supposed to help relieve the pain. And then we have people that think that patients might abuse the drug, which indeed is probably true as well. I will list a couple of points that I want to come across, talk a little bit in depth about it, and then I will let y'all decide on where you stand on the issue. So we'll just jump right into it. So, today in 2018, the United States has 31 states that have legalized cannabis for either medical or recreational use. And when I say recreational use, I mean anything for the fact that it's going to help please you in some type of way. Um, According to the Harvard Health publishing article, they list several proven facts as well as to why medical marijuana should be legal. The first point is it can help control chronic pain. And when I say chronic pain, not pain that like comes and goes like a headache. Chronic pain is like, let's just say a war vet, he loses a leg and he just doesn't, like, his nerves and his legs still bother him all the time. A doctor may prescribe him some medical marijuana to relieve the pain. In doing this also helps take away highly sedating drugs. Sedative drugs can leave patients loopy, not really understanding things, like pretty much leaving them in a daze. So the medical marijuana can help their pain, but also still give them the freedom of doing their day-to-day activities. Another point that I want to mention is that you cannot overdose over medical marijuana. There is no cases in any of the years up to 2018 where a individual has overdosed over smoking too much medical marijuana. Of course, whenever you do have pain, you are given drugs that are that can be abused very easily. And overdoses do happen with these drugs. It is a fact that we just have to acknowledge whenever looking at this issue. Another point that I want to bring up is that medical marijuana can take the place of Advil and Aleve. It is a proven fact that over time, over a long period of time, if you take the same drug, your body is supposed to become immune to this, and it will not work the way it's supposed to. So if we have an individual that is in pain 24/7 and they're taking Advil and taking Aleve to relieve the pain, eventually their body will become immune to it and it will stop working for them. So using the medical marijuana can help lessen the intakes of drugs that an individual will use to relieve their pain. My next point I want to leave y'all with is that medical marijuana has been tested in individuals with Parkinson's disease. If you don't know what Parkinson's disease is, it's a disease that leaves individuals with extreme tremors. Their hands are shaking uncontrollably, they cannot stop. I know there's a couple TV shows like on TLC where they experiment with the medical marijuana, either drops or physically smoking it, and their tremors have stopped instantly. Um, they do still do a lot of testing on this, on the drug, just to make sure that it works the same for everybody, that everyone gets the same um, relief from the medical marijuana that it's supposed to give you. So with those 3 points, I'm going to leave you. I want y'all to think about, are you pro medical marijuana or are you against it? Thank you.